Hello there, my name is Brittany Beam,
And I'm Tamara Bellalove.
and we are gathered here today to discuss substance abuse
And the role of occupational therapy.
As long as drugs have been used, there have been those who abuse them, and efforts to rehabilitate these people. Since the 1800s, drug abuse has been a problem after morphine, cocaine, and heroin were used for their amazing curative properties. In the early 1900s, there was a focused global and national suppression of drug abuse, which made quite an impact. Benjamin Rush was the first to openly believe that alcoholism wasn't a moral failure, but rather a direct result from alcohol itself. Prior to that, alcoholism was a criminal offense treated by placement in a mental institution or by intense prayer.
After the 21st Amendment was passed, ending prohibition, Dr. Bob Smith and Bill Wilson founded AA, also known as Alcoholics Anonymous, in 1935. AA aims at providing a welcoming environment for those with addiction, as well as a spiritually based approach to recovery. From AA came many other branches for other substances, such as Cocaine Anonymous, Narcotics Anonymous, and Marijuana Anonymous. However, in the 1960s, hallucinogenics, amphetamines, and marijuana became more available and abuse became more prevalent again. From 1992 to 1993, 5.5% of pregnant women were found to be taking some form of harmful drug. In 1995, more than 5 million Americans reported in a survey that they smoked marijuana frequently. In 1996, the Office of Drug Control Policy detected an increase of heroin in use in young adults. Today, drug abuse continues.
Occupational therapy can be an instrumental part of drug rehabilitation. Therapists can help identify areas that people with substance abuse issues have developed, such as impaired cognitive function, impaired fine motor coordination, and impaired ability to take care of oneself. For example, in a case study titled Occupational Therapy and Substance Abuse, a case study of a teen, the occupational therapist had the teen arrive to therapy in the late morning to accommodate her poor sleeping habits. However, with time and progress, they were able to slowly move that time to 9 a.m. The OT also helped the teen evaluate her daily routine and move around her schedule to make it healthier, which gives her more time to learn, eat, and rest. Once the teen began to progress, the OT helped assess her interests and abilities and helped her to enroll in and finish a course in estate management, which helped the teen gain confidence and learn about her abilities. The occupational therapist helped implement critical changes in the teen's life and promoted the development of self-efficacy and self-confidence.
According to a study titled Clients' Perceptions of an Occupational Therapy Intervention at a Substance Use Rehab Center in the Western Cape, it is stated that dysfunctional occupational performance may be a consequence of engaging in addictive behaviors and may give rise to ill health and social problems. People who engage in substance use neglect their daily roles, tasks, and activities as the activity of substance use consumes their time and interest. This study also helped to identify key themes that patients thought OT helped with during the rehabilitation process. The first of this area is they believed that occupational therapy helped keep them clean. They also thought that occupational therapy helped take away drug abuse by replacing it with something else, another meaningful occupation. They also believed that occupational therapy helped them not want to be the person they used to be. And lastly, they talked about occupational therapy helping to take them out of the life they were living and helping them find ways to actively participate in a new life that was fulfilling.
According to AOTA, occupational therapy can help people recognize how their substance use affects roles that are most meaningful. It helps people explore and make those links and move toward occupational roles and patterns they want to achieve. For example, an adolescent who abused drugs may have trouble participating in being a student. Occupational therapy can help the adolescent relearn how to be a student by working on time management skills, social interaction, and other skills that the substance abuse may have affected. Again, according to AOTA, occupational therapy practitioners examine the habits and behaviors of clients that occur each day and throughout the week. Practitioners then construct or rebuild those occupational roles by determining what activities bring clients the most joy and sense of well-being without drugs or alcohol.
Now, in order to do all of these things, there's many assessments that need to be done. There was not, in our research, we didn't find one assessment that was used to evaluate drug abuse, but many were used, and a compilation of all of them helped the occupational therapist come to a conclusion about the areas that need to be worked on in order to help the patient improve their quality of life. Some of these assessments that are often used by occupational therapists identify these areas that they wish to improve, and the vehicle that they use to improve this is, in fact, occupations. Some of these tests that are used in this particular area include the Occupational Performance History Interview. This test specifically looks at a patient's drive, a patient's patterns, and a patient's occupational performance and the environment. Another test that is commonly used is the Rosenberg Self-Esteem Scale. According to a study titled Occupational Performance, Self-Esteem, and Quality of Life in Substance Addictions Recovery, this test is used to assess self-satisfaction, self-worth, self-respect, and personal pride. This is really important when working with a patient who has suffered from previous substance abuse, because a lot of the times these are underlying problems that are going to hold back the patient from being able to fully participate in the occupations that would make them happy. A third test that's often used is called the Quality of Life Rating, or QOLR. This scale measures an individual's perception of quality of life by comparing what they expect their life to be like to the current situation that they're in. Not only does this give the occupational therapist a sense of where this patient is starting, but it also gives them a chance to see where they would like to go. It also gives a patient a chance to self-reflect, which is just another step to aid in recovery.
So in summary, we're going to discuss the question of what can an occupational therapist do for someone suffering from substance abuse? So an occupational therapist can start and they can evaluate. So they can evaluate how well a person can function from day to day and the ways in which they can do this. Next, an occupational therapist can help. They can help the person set short and long-term goals that can help them to be successful in the recovery process. If the patient relapses, the occupational therapist can analyze the event to look for behavioral patterns. This may help the therapist develop a different intervention plan. Next, an occupational therapist can implement. They're able to implement the ways in which a patient may begin to gain control of their lives. These include the previously mentioned strategies. A few examples could include the new coping skills that are healthy and effective, learning and developing money management strategies like they did in the case of the teen that we talked about previously, and they can learn how to function in social settings that do not include the drug. Learning how to reconnect with family and friends and developing the skills and techniques necessary for obtaining and keeping a job are important as well. Lastly, an occupational therapist can reevaluate. They can reevaluate a patient and the likelihood that the patient may relapse and come up with strategies and techniques to prevent it.
So the role of occupational therapy has come a long way in assisting in this field, but if you think about it, occupational therapy fits in perfectly, and in my opinion, enhances the quality of treatment a patient receives. In fact, I really believe that it's doing a disservice to the patient seeking help not to implement occupational therapy into their rehabilitation process. Occupational therapy aims to enhance people's quality of life by helping them do what makes them happy. But oftentimes, people who abuse drugs forget about what exactly makes them happy because all they know is that the drug does just that. Occupational therapy not only helps end the substance abuse, but it also helps the patient fill the void that removing the substance has created. This will help the patient stay clean over an extended period of time because they've begun to explore what makes them happy other than using a harmful substance, and allows them to participate in more activities that let them lead a more fulfilling and happy life.
Today, we hope you have learned a little bit about substance abuse
and occupational therapy.
My name is Brittany Beam.
My name is Tamara Bellalove.
And have a great rest of your afternoon.